So we're doing heart anatomy. Your heart's going to be located in the mediastinum, and it's going to be from your second rib to your fifth intercostal space. It is going to be about the size of your fist, and is going to sit on an angle with the left ventricle, which will be slightly larger, which will have more muscle in it than the right, which will be angled off to the left side of your chest. Your heart is going to be inside of its pericardial cavity, and on the surface of the heart you're going to have the visceral pericardium, and outside of the visceral pericardium you're going to have your parietal pericardium. We'll talk about that a little bit in a second. So visceral pericardium is going to be the outer layer of tissue on your heart. It's also called your epicardium. It will fold over itself and cause a second outer layer called the parietal pericardium. So if you look at this balloon and you see this fish pushed in here and there's a layer of the balloon on the surface of the fish, that's a visceral layer. Viscera is an organ, so the visceral layer is on the organ. And the outer layer is the parietal layer. Okay, so that's going to be our visceral layers. That is the same thing as our visceral pericardium is the same thing as our epicardium. And then we have our parietal layer. So let's go through the layers of our heart wall. Outermost layer, we'll have our fibrous pericardium. Inside of the fibrous pericardium, we get our parietal layer of the serous pericardium. It folds over itself. Then we get our visceral layer of the serous pericardium. Another name for the visceral layer, epicardium. Next, we get the myocardium. Myo is in muscle. And then finally, we get the endocardium. Endo is in within, epi is in above. And within that we get our heart chamber. I'm going to want you guys to be able to follow a drop of blood through the heart. So we're going to look at that for the first time now. So blood is going to enter the right atrium, which is right here. So let's go through anatomy quick. Right atrium, right ventricle, pulmonary trunk. Right and left pulmonary arteries, right and left pulmonary veins, left atrium, left ventricle. So blood enters the right atrium through the superior and inferior vena cava. Blood leaves the right atrium, goes to the right ventricle, goes to the pulmonary trunk, gets pumped out to the right pulmonary artery and left pulmonary artery, then comes back to the heart via the right pulmonary vein and the left pulmonary vein, and enters the left atrium. Go to the left ventricle contracts, sends the blood through the aorta, and it goes up, over, and down. So ascending aorta, aortic arch, and descending aorta. So I want you to know this blood flow that I'm going to say right now in detail for your test. Superior and inferior vena cava will drain into the right atrium. Blood passes through our tricuspid valve into the right ventricle. Blood leaves the right ventricle, passes through the pulmonary semilunar valve into the pulmonary trunk. Right pulmonary artery, left pulmonary artery, we go to the lungs. Blood leaves the lungs via the right and left pulmonary veins. They will drain into the left atrium. Blood leaves the left atrium, passes through the bicuspid valve, goes into the left ventricle. Blood leaves the left ventricle, passes through the aortic semilunar valve into the aorta. It goes up, over, and down. It goes off to our tissues, and we start over again. I'm going to say it again. Superior and inferior vena cava drain into the right atrium. Blood passes through the tricuspid valve into the right ventricle. Blood then hits the pulmonary semilunar valve, hits the pulmonary trunk, right and left pulmonary arteries to the lungs, right and left pulmonary veins to the left atrium, through the bicuspid valve to the left ventricle, to the aortic semilunar valves, into the aorta, and then we go up, over, and down. So ascending aortic arch and descending aorta. One more time, but I'm going to start giving you some actions here. So my vena cava drain into my right atrium. Blood is filling the right atrium. Once the pressure in the right atrium grows enough, that will bust open my tricuspid valve. Blood passes into the right ventricle. As the right ventricle fills up, at some point it will contract. When it contracts, it shuts this tricuspid valve and pressure builds to bust open this pulmonary semilunar valve. Once this pulmonary semilunar valve busts open, blood goes up into the pulmonary trunk. We go right pulmonary artery, left pulmonary artery to the lungs. Then we go left pulmonary vein, right pulmonary vein, back to the left atrium. Pressure builds in the left atrium until we can bust open this bicuspid valve. Then we start to fill up the left ventricle. The left ventricle contracts, it shuts that bicuspid valve. Pressure builds in the left ventricle until it is higher than that of the aorta, and that'll bust open the aortic semilunar valves. We send the blood into the aorta, ascending arch, descending aorta. If you notice, the left ventricle, the wall of the left ventricle, the muscular wall is slightly thicker than the right ventricle. Left ventricle and the right ventricle will actually contain the exact same amount of blood, but the muscular, and they're going to be the same size, it's just that the left ventricle has a thicker wall of muscle than the right ventricle. It's also important to point out that in this picture, arteries are not red and veins are not blue. The way you identify an artery from a vein is an artery is going to be a blood vessel that carries blood away from the heart. A vein is going to be a blood vessel that will carry blood back to the heart. We have two circuits. We have a pulmonary circuit and we have a systemic circuit. The pulmonary circuit, the blood traveling away from the heart is going to be deoxygenated. The blood traveling back to the heart will be oxygenated. Why? Pulmonary circuits carrying deoxygenated blood from the heart to the lungs. Oxygenated blood from the lungs back to the heart. Our systemic circuit will carry oxygenated blood from the heart to all the tissues in your body. All right? Now it'll carry the deoxygenated blood from all the tissues in your body back to the heart, so it could go to the lungs for oxygen. Here's some blood vessels. All right, so we're going to have our coronary arteries. Coronary arteries are going to be right at where our aortic semilunar valves are here. Oops. Right here where our aortic semilunar valves are. So my ventricle contracts, blood goes into the aorta, blood tries to regurgitate or go back into the left ventricle, but those aortic semilunar valves slam shut. When they slam shut, blood flows into our coronary arteries. So we'll have our circumflex artery, we have our anterior interventricular artery, we have our left coronary. So we go left coronary artery splits into the anterior interventricular and circumflex artery. Right coronary artery is going to travel down and around to the back of the heart, and it's going to give off the marginal artery. Here we're going to have our great cardiac vein, which will be lying right alongside our anterior interventricular artery. Another name for the anterior interventricular artery is the widowmaker. That is the artery that usually gets a blood clot when you get a massive heart attack. Alright, let's look at some anatomy inside of here. So, my superior and inferior vena cava drain into my right atrium. My fossa ovalis, that's a remnant. We'll talk about that later. My superior and inferior vena cava drain into my right atrium. Blood flows from the right atrium through my tricuspid valve into my right ventricle. My right ventricle contracts, pressure builds, blood busts through my pulmonary semilunar valve, goes to my pulmonary trunk, into the left and right pulmonary arteries. We go to the lungs. My right and left pulmonary veins drain into my left atrium. Blood passes through the mitral valve or the bicuspid valve, another name for it is the mitral valve, into the left ventricle contracts, pressure builds, busts open the aortic semilunar valves up, over, and downward into the body. Now let's check out some anatomy here. Here's my right atrium. Within the right atrium we have the fossa ovalis. It is the remnants of the foramen ovale. It used to be a hole that connected the right atrium to the left atrium. What it did is blood used to just go straight from the right atrium to the left atrium, and the reason for that was to avoid the lungs. Why? When infants are when you're a fetus and you're inside mama's belly, there's no point in oxygen going to the lungs or there's no point in blood going to the lungs for oxygen. Why? Because baby's not breathing. Baby's inside, fetus is inside mama's belly. It's not getting oxygen in there. So what happens is the blood just bypasses that and goes to the other side of the heart. Fetus gets oxygen from mom. Next, here's our tricuspid valve. It is named the tricuspid valve because it has 3 leaflets. The tricuspid valve will be anchored to the wall of the right ventricle via chordae tendineae, which attach to papillary muscles. Papilla means nipple. These are nipple-like projections coming from the wall of the right ventricle. And then these funny-looking things in here are called trabeculae carneae. Next, we get our pulmonary semilunar valve. This will also be a tricuspid valve. It will have 3 leaflets to it. Pulmonary trunk, right and left pulmonary arteries, aortic ascending, aortic arch, descending aorta. I want you to know all the blood vessels on this picture. You'll have your left pulmonary veins and right pulmonary veins, left ventricle. We have our bicuspid valve, named that because it only has 2 leaflets. That will be anchored to the wall of the left ventricle via papillary muscles once again, and chordae tendons that are attached to those papillary muscles. More trabeculae carneae in here. This is the interventricular septum. Hidden behind here we would have an interatrial septum. If you notice, the wall of the left ventricle is thicker than the wall of the right ventricle because it needs to be stronger so it can pump blood to the whole body rather than just the lungs. Okay, so 1, blood returning to the heart fills the atria. The right and left atria are filling at the same time. As the ventricles, blood returning to the heart fills the atria, putting pressure against the AV valves, atrioventricular valves, tricuspid valve and bicuspid valve, so the valves that separate the atrium from the ventricles. So my right and left atria fill with blood. As they fill with blood, pressure will build, bust open the AV valves. When the AV valves bust open, we start to fill the ventricles up with blood. After some period of time, the ventricles contract. When the ventricles contract, these papillary muscles contract right along with it. They pull on the chordae tendons and shut the atrioventricular valves, the bicuspid and tricuspid valves. Because of the shape of the valve, as the ventricle contracts and puts pressure, it starts to gain pressure. The blood pushes against those valves and it seals them shut even tighter. As pressure builds within the ventricles, sooner or later it will build to be greater than the pulmonary trunk pressure and the aortic pressure. When that pressure in the ventricle is higher than those, ejection phase occurs. Blood leaves the ventricles and goes into the pulmonary trunk and into the aorta. My ventricles relax and my semilunar valves now close, preventing the blood to go back into the ventricles. Microscopic anatomy of cardiac tissue. They're going to have some special features. First off, we're going to have desmosomes, aka macula adherents. They're going to be there basically to glue the cells together, keep them tightly bound together. Next, we get gap junctions. These are going to be protein channels that allow ions to pass back and forth between cells. This will help them contract in unison. And then finally, we get intercalated discs. Our intercalated discs are going to be a double membrane that'll separate the cells and the cardiac muscle fibers. Once again, these help out ensuring that the cells will contract in synchrony. Okay, let's look at the blood vessels again. So we have our superior and inferior vena cava, right atrium, right ventricle, pulmonary trunk, left pulmonary artery, right pulmonary vein, left pulmonary vein. Here's your left atrium, left ventricle. Blood leaves the left ventricle, goes into the aorta. It comes down. If you remember, we have our coronary arteries. So my left coronary artery is hidden behind my vena cava here. It will split into the anterior interventricular artery and the circumflex artery. My anterior interventricular artery here is sitting on top of my great cardiac vein, which is sitting in the anterior interventricular sulcus. Here's my right coronary artery, which will give off my marginal artery. Alright. That's about that for this slide. Here's the apex of the heart. This is called the ligamentum arteriosum. It is a remnants of the ductus arteriosum, and what that did was, this is our pulmonary trunk sending blood to my lungs. In the fetus, we said the fetus is inside mommy's belly. Fetus isn't breathing oxygen, so we don't need to send the blood there to get oxygen. We just need to send blood to the lungs to nourish them. So rather than sending blood to the lungs for oxygen, it bypasses it and uses this shunt to go straight to the aorta rather than going to the lungs. Now we have a posterior view of the heart. Here's our pulmonary veins, here's our pulmonary arteries and the aorta. This guy right here is our coronary sinus. This is going to drain right into the right ventricle, right into the right atrium. What else do I want you to know here? Everything else here is pretty good. Alright, tricuspid valve, it has 3 leaflets. Bicuspid valve, it has 2 leaflets. Our valves are connected to the ventricular walls via chordae tendons, which insert into papillary muscles. Then we have our trabeculae carneae in here. Here's our interventricular septum. It separates the ventricles, and there would also be an intraatrial septum separating our atria, but it's hidden here by my pulmonary trunk. Alright, coronary artery, right coronary, left coronary, which is hidden by a pulmonary trunk, splits into anterior interventricular and left and circumflex. Here's my coronary sinus. Alright, great cardiac vein. Middle cardiac vein is on the posterior aspect of the heart. That's